Hello, my name is Tiana Taylor, and this is my presentation on autism in minority and marginalized populations. It is imperative for individuals with autism spectrum disorder to have access to early care and treatments, and this is beneficial to them because it will provide them with communication and social skills that they will need to independently navigate ASD throughout their world experiences. It is necessary, but it is not always attained. And this could be for many different reasons. However, marginalized populations specifically face a multitude of barriers which hinder access to autism diagnosis and early intervention. So, factors such as society, culture, and socioeconomic status will affect minorities and marginalized populations disproportionately and will affect their access to early diagnosis, intervention, and care. Now for the presentation of research supporting this topic. First, consider society. Race and ethnicity can play a role in how these populations are treated, as well as how these populations view the medical field. Minorities have historically been mistreated medically, which would lead them to be more distrusting of the medical professionals that they seek help from. One study reported that parents who were Hispanic or African American received lower level of care and felt neglected by their care providers. This could be attributed to bias within the medical field and medical care professionals. Another article highlights the importance of healthy patient-provider relationships to increase the number of people seeking care. More people will be able to go out and seek help if they feel that they can trust their medical care providers. Okay, due to the presentation of some autism spectrum disorder symptoms, Black parents might wait longer to evaluate certain behaviors due to a lack of knowledge in the area or because they don't perceive these behaviors as something to be concerned of at first. And minority parents are more likely to avoid testing at the earliest signs or until those symptoms became maladaptive. So minority parents are more likely to consider some of the symptoms of autism spectrum disorder as normal childish behaviors, and they would wait to get them tested until those behaviors started interfering with daily life, while white parents are more likely to seek out assistance from various professionals at an earlier time. Another facet of culture is language. So one study which examined the differences in individualized education plans among Spanish-speaking individuals and English-speaking individuals found that those who spoke English had individualized education plans which included more skills and goals and more hours in the programs. This made Hispanic people feel a little more left out in the process of helping their child with ASD and discouraged them from completing the process. All right. So lastly, we have socioeconomic status. One article which examines disparities in early intervention in metropolitan areas found that people of lower socioeconomic status were less likely to participate in early intervention and treatments. And this could be for a multitude of reasons. It could be due to transportation, finances, and things of that sort. One resource from the University of Wisconsin-Madison took a look at service deserts and oases and found that people who lived in rural areas had less access to resources in their area. As you can see from this graphic here, in northern Wisconsin, this is a more rural area. There are more sparse locations for ASD treatment locations. And people who live like in the middle areas here will have to travel further to get to a location, whereas people here in more densely populated areas don't have to go as far. Now let's move on to the presentation of research on the opposing thesis. It was difficult to find research which directly opposed my thesis. However, I found some articles which had a different perspective in the same topic. On the left here, we have disparities in school services. Research from this study shows that minority students utilize more school services than their white peers, which is beneficial to my point, that it would be like opposing because it would mean that minority students are actually receiving more care. However, there were many limitations and survey issues within this study, and the accuracy is being tested. So the article pushed for more research on the topic. On the right here, we have disparities in Medicaid services. Medicaid is a federal and state funding program for lower income individuals. This study found that kids enrolled in Medicaid receive services within their communities and schools, which is good. This is what we want. However, this study also found that white children were often being treated at outpatient facilities, which tend to be a little more nicer than in regular schools, and probably more pricier. So they're probably there because they can afford to be there. Now let's move on to the implications of this research. All right, so for the implications, white parents are more likely to seek professional help before minority parents are. This means that white kids are more likely to have access to early diagnosis and early treatment options. Minority parents are often not taken seriously, and minority children are often misdiagnosed. When minority parents eventually take their kids to get tested at later times, these children are more likely to be diagnosed with a behavioral issue or something like ADHD. This hinders them from attaining the proper autism care. Families who speak different languages miss out on treatment and are underrepresented. There are not a lot of options for people who speak different languages, and they do not feel included with sole English speaking treatment options. They're also largely underrepresented in research. Low socioeconomic status populations are less likely to show up for early intervention programs. This could be due to things like transportation, finances, and things of that nature. Less education means less knowledge about ASD. This is also a socioeconomic status thing. People who don't have the knowledge about ASD miss the signs and symptoms early on, which hinder early diagnosis. And with all that being said, this is my personal reflection on the information that I've learned. So, in my own experience as a Black woman with a Latin background as well, I have noticed a lack of understanding and consideration for mental illness and disorders in my own community, and that is what spurred me to go into this topic of autism in marginalized and minority populations. And a lot of the things that I learned throughout my research felt familiar, things that I kind of figured were the case anyway. However, I was able to get a lot of specific information on how things like socioeconomic status and society and individual beliefs and culture all impact autism diagnosis and treatment individually. And after going through the information, I feel like there needs to be a standard for how we educate people about autism spectrum disorder and how it is treated. And in conclusion, it is apparent that there are disparities in the diagnosis and treatment for minorities in autism. As we've discussed, factors like society, culture, and socioeconomic status could be barriers to receiving early diagnosis and early access to care and treatment. As a society, we must work together to make ASD care equal and accessible for all. And some of the ways that we can do this include increased education on ASD, making that in education more well known and provided to everybody so they understand like the signs and symptoms. We can have more accessible facilities. We can have call-in centers. That way people could ask questions instead of appointments, and stay on track with the progression of their early treatment plans. And we can also train care providers. This way, they are culturally sensitive and they know how to handle diverse patients. Thank you for viewing my presentation. I hope you enjoyed.